This is Susie. She has had a mild case of Pectus excavatum, or a flat chest. You may have already seen the video of how to apply the chest brace for this, and thankfully she was able to have this removed yesterday. So not sure how well you can see, but she's not got that indented area like she had before. It's not 100% perfect. Unfortunately, Susie is a bit of a deformed kitten. She was born with quite a few deformities. Her front legs, you might be able to notice, are a bit bowed and deformed. And we're still taping on her back legs because these were very deformed as well. But we've been struggling with getting her to tolerate the chest brace, and she's had it for about 10 days now. So we're just going to see what she's like without it and try and get by with some physiotherapy now, and we're doing this at every feed. So when you're doing this, it should be every couple of hours, every 2 to 3 hours, day and night if you can. Obviously, the more frequently we do this, the less likely the chest is to stay in that flat or indented position. And so what we want to do is, obviously you can feel the ribs, and you'll probably be able to feel on your puppy or kitten where it kind of feels a little bit odd, where it's indented and kind of the ribs kind of are just at a bit of an odd angle. I can't really feel it with Susie anymore because it is pretty much normal now. But basically what you want to do is just gently hold and then put some gentle, very gentle pressure on the ribs. And ideally what you want to do is you want to time this with when they're exhaling. So when they're breathing in, obviously their lungs are inflated, but what we want is, as they're breathing out, we want to then hopefully squeeze that the chest is more likely to give to this gentle pressure that we're applying if we apply it as they're breathing out. Thankfully, Susie's really tolerant of this. As you can see, she's suckling away on my fingers, purring her head off, and I'm able to hold it for quite some time, and she's still able to breathe absolutely fine. If you have a really severe case of this, then you'll have to do it in smaller intervals just so that they can catch their breath. And I'll try and lift her up, but you might be able to see that as I'm doing this, it does actually pop the front of the chest out, and that is exactly what we want. And this just helps to increase elasticity in the ribs. And it just helps to make the ribs a bit more pliable as well, so that they're not stuck in that flattened position. The other problem with Susie is that she is a lone kitten, so she doesn't have litter mates to snuggle up to, which can be another cause of them getting a flat chest. So we've been giving her lots of nice bumpy bedding, toys to cuddle up to, but she has still been spending a lot of time on her chest. So this is we're just trying to prevent her from getting that indented chest again. And the other thing you can do if you have a puppy or kitten that's struggling to breathe with this physio is you can just do gentle stroking downwards of the ribs